اتكلم على الفايبروميالجيا، ولقيتني كنت اتكلمت لما كانوا الناس زمايلنا بتوع الروماتولوجي وبتوع السايكاتري كانوا موجوده الدكتوره مي والدكتور، لان انا كنت بصراحه عايز اناقش الموضوع معاهم. يعني الدكتوره مي كانت موافقاني ان هو ستريس، وكنت انا مسمي المحاضره دي فروم ستريس تو فانكشنال سيندروم ده في البروجرام. لكن اكشولي كان لازم الواحد يستريس شويه على انه دي عباره عن brain, bad news from the brain. It is a bad news from the brain. It is a brain disease. يعني انا مقتنع تمام الاقتناع، وابتدوا بره يتكلموا على انه ده مش تبع الروماتولوجيست ومش تبع نيورولوجي ولا يعني السايكاتري ممكن طبعا يبقوا ريليتد ليه قوي، ولكن العيان ما يبقاش مقتنع ان هو دماغه بايظه، انه هو عنده سايكاتريك ديس اوردر، وعشان كده بيبقى ريزيست تريتمنت وما يروحش الدكتور تاني. فاحسن دكتور يعالج الفايبروميالجيا هو دكتور علاج الالم، بيبقى رايح انه عنده الم وعايز يتخفف. فده مهم جدا ان اقول ان هو ده تبع الناس، ان البين كلينيشن، لان عندنا هنا الناس ما بتحبش تروح لسايكاتريست. What is fibromyalgia? Fibromyalgia is a syndrome of pain and fatigue, widespread pain and fatigue. It affects mainly female. Okay, this fibromyalgia syndrome containing another syndrome, the syndrome of restless leg syndrome. This is the one syndrome, irritable bowel syndrome. So it is a syndrome containing other syndrome. So it is a very big syndrome. The big syndrome usually starts from the brain, and now this is a brain disease. How can deal with this disease? How can assess this disease and diagnose this disease and manage and treat this disease? So the clinical picture at orders. Number one, poor sleep. Almost always think that fibromyalgia is almost always has poor sleep. So poor sleep is from the brain. Headache. 70% of or more from patient has irritable bowel syndrome. So it is a syndrome related to syndrome having almost always sleep. So cognitive memory problems associated also with numbness, irritable bowel, temporomandibular joint disorder, dryness in eye and mouth, morning stiffness, anxiety and depression, palpitation. Consider that some patient going to cardiologist to treat fibromyalgia. Palpitation leading the patient to perform a cardiac catheter, coronary artery catheter. All of these symptoms wax and wane. كلها تروح وكلها ترجع تاني. ايه السندروم العجيبه دي؟ ولما اقول ده برين ديزيز يعني البرين بيخف ويرجع تاني. So I will investigate this wax and wane syndrome containing syndromes in mainly in female patients. Introduction. This is the musculoskeletal. Most of female patients going to rheumatologist, which is diagnosing as 11 tender points from 18 points. How come if tender point is 10 or 9 or 2, it is not a fibromyalgia? It must have 11 painful point from 18. لازم 11 من 18. ما ينفعش واحدة، ما ينفعش اتنين. How come? Okay, it is a musculoskeletal, not a musculoskeletal, because the pathophysiology will document that it is a brain disease. What is the precipitating factor? I will enumerate briefly. Genetics, familial tendency, environmental factor affecting the patient, physical trauma, psychological trauma, mainly in female, get divorced or losing his parents or her parents. Drug withdrawal, especially steroid withdrawal, precipitating fibromyalgia. any chronic administration of some drug affecting the sympathetic or the central nervous system, sudden withdrawal or withdrawal after a long term of administration will precipitate fibromyalgia. Irritable bowel syndrome, which is associated with more than 0.5% of fibromyalgia patients. It describes that irritable bowel syndrome is a cause of the fibromyalgia, because irritable bowel syndrome get a deficiency in vitamin absorption and amino acid absorption, which will lead to decrease in tryptophan absorption, which is a precursor of serotonin, which is an inhibitory mediator for pain. So this decrease in inhibitory mediator of pain excite pain or release pain or induce pain. Another one, fibromyalgia patient, there is a deficiency in amino acid absorption, so collagen in muscles will not get the muscle repair better. So the irritable bowel syndrome is a precursor of fibromyalgia. Actually, a lot of patients have a irritable bowel syndrome and have had no fibromyalgia. I will distressing about the neurotransmitter in pain pathway. Here is the stimulus, then transmission to the spinal cord by glutamate and substance B, then perception of pain, then descending inhibition by serotonin and noradrenaline. Noradrenaline and serotonin is inhibitory, so it will be decrease in pain. Glutamate and substance B is a pain transmission, so will increase in pain. Stress and for these neurotransmitters. Okay? What is the pathophysiology of fibromyalgia? The first theory, which is musculoskeletal unit. This is a musculoskeletal unit. This is the muscle, this is the tendon, which is including the paratendon, tendon sheath, and the enthesis. They classify that fibromyalgia has enthesis and the muscle disorder made a sensitization which lead to fibromyalgia. So this is the connection between the bone and the enthesis will be tear every now and then, so it will be sensitized, and barrage of impulse or lot of impulse will created or transmitted to the spinal cord, which will be sensitize the spinal cord and its neurotransmitters. Okay, and see, this is the cause. We will see this picture, this slide. This is the stimulus, which is low threshold stimulus, non-painful, must be not singling or activating the spinal cord. It will activate the spinal cord, okay? It will activate the spinal cord from here. Then the spinal cord will be irritated, the pain amplification, and sensitized, and this sensitization will be greatly with following and the barrage of impulse go to the brain and sensitize the brain. So the impulse and the minor impulse from here will be sensitize the brain. So it is a secondary, is the brain disease. Here it is a secondary brain disease in this theory of musculoskeletal units theory. So this will lead to increase to sensitize stimulatory neurotransmitter for pain, which is glutamate and substance B. This is a document of the theory that neurotransmitter substance B increase in CSF of fibromyalgia patient in these three studies. This is the first document. Also in this study, the CSF glutamate increase in fibromyalgia patient than control. So this is a new document that the neurotransmitter will be increased, but this neurotransmitter increase from the above, from the brain, or increase from the periphery, from the muscle fibers, or the musculoskeletal unit theory. What about another theory for fibromyalgia? Brain disease. What precipitating this brain disease, fibromyalgia? Cognition, family support, and job satisfaction is deficient in these people. مش لاقي تعاون في الأسرة. جوب مش راضي عن الشغل. الشغل مش هو ده أمله. مش هو ده اللي عايز يعمله فيه. Personality, hypervigilance, حذر اكتر من اللازم. يعني انا واقف دلوقتي والباب ده مفتوح، فانا حاسس ان حد ممكن يعدي وبعدين يتكلم فيقاطع محاضرتي، فاضطر اسفا اروح اقفل الباب. الان انا اقوم قافله كده عشان خاطر الناس اللي هنا تسمع كويس، حاجه من كده، وبعدين الله انا قفلته كويس؟ لا ده اتفتح، ارجع تاني عشان اقفله كويس. اتقفل الباب وبعدين ابص عليه تاني، مش وسوسه لكن حذر ان الناس هنا ما يبقاش في انتربشن عشان تسمع المحاضره. دي معنى كلمه هايبر فيليجنس. فيلينج اوف هيلبلسنس، الناس اللي حواليا في البيت او في الشغل مش بيساعدوني عشان اعمل حاجه كويسه، دايما عايز كل حاجه تطلع كويسه. في الاخر بور كابينج استراتيجي، مش قادر انا اعمل ده لوحدي، كانه بالظبط عيان عايز يوصل to ideal condition. The patient want to be everything is ideal. He cannot do that. So it will be hypervigilance, feeling of helplessness, poor coping strategy. This is the criteria of fibromyalgia patient. With emotions, the female has more emotions than female. So this disease is a disease of female. 10 female to 1 male. Stress activation by withdrawal of drug or infection, chronic infection, or autonomic dysregulation. Almost always sleep dysfunction from the brain. So what about the sleep dysfunction? Infrequent progression of stage 3 and 4, the stages of non-rapid eye movement sleep. Always infrequent progression to stage 3 or 4. 90% of patients delta phase not occur properly. Delta phase correspond to secretion of growth hormone. Growth hormone not released, so the repair of muscle is not accurate and not fully performed. So the brain disease is a precipitating factor of sleep dysfunction. This sleep dysfunction leading to all of the other syndrome because it descends from the above to low. Not the musculoskeletal unit, it performs this syndrome, but the brain can do anything. The brain is me. It is my personality, which can prepare for any syndrome can occurring psychologically or emotionally. This is a recent study in Pain Journal documented that the patient with irritable bowel syndrome has altered gray and white matter microstructure in pain-related signal in the brain. The irritable bowel syndrome patient has this alteration in white and gray matter. So it is a brain disease. Okay? What is the pathophysiology of the brain disease? Here, where is the disease? The first theory gets the disease start from here, but the disease is here. Hypervigilance, not coping, helplessness from the other. So it will think and think. Bad news from the brain starts this syndrome. It will descend, followed by decrease in descent of inhibitory neurotransmitters, which is the serotonin and noradrenaline. This decrease in any neurotransmitter in any site of CNS will lead to hypersensitization, upregulation of the receptor in the spinal cord. So it followed by upregulation and sensitization of the spinal cord, which will lead to respond to minimal stimulus, any minimal stimulus, with the normal musculoskeletal unit. So this is the actual and the believable theory of the fibromyalgia as a brain disease. As a brain disease, I must regulate and program this brain to cure this condition. I will see with you what can cure this condition. So, pathophysiology again. This is a functional MRI, as said Professor May. That is a in the functional MRI, the area which is responding to high intensity stimulus now in the brain responding to low intensity stimulus. So it is a brain dysfunction. The hypodopaminergia is the site, is the state in the patient of fibromyalgia, central hypodopaminergia, prevalence in female, 2 to 4% of female population all over the world have fibromyalgia. The incidence in female 10 in relation to male. Onset is between 30 and 50 years, and common with the patient with chronic rheumatic condition. So the patient of fibromyalgia always go to rheumatologist, and they diagnose the state as 11 painful area from 18 area of patient. 11. Why 11? It is a disease of the brain, may be precipitated by rheumatic condition, but the rheumatic condition is an state, and the fibromyalgia is another state. So the rheumatologist now combining any rheumatologist state with treatment with antidepressant, and the patient get improved because it is a brain disease precipitated from chronic state of withdrawal or chronic state from the brain. Diagnosis by exclusion, and diagnosis with the American College of Rheumatologists says that widespread at least 3 months, pain from 11 point out of 18 tender point. Then they change their mind. They calling that tenderness can be widespread without tender points. This is the American College of Rheumatology 2012. They change this mind in that tenderness can be widespread without any tender points. So this is a new definition for fibromyalgia in rheumatologists. Diagnosis is by exclusion. Treatment. What is the treatment of such a condition? First is difficult, but generally compromised in 3 approaches. First is psychological. So it is a brain disease. Behavioral. Then physical therapy. Lastly, pharmacotherapy. The patient can improve without pharmacotherapy, but psychological and behavioral therapy improves the condition. Also, physical therapy improves the condition without pharmacotherapy. So the treatment is not difficult if you start with psychological, behavioral, and physical therapy. First, reassurance. If the patient knows what is affect his body, it will be what? It will be satisfied. Just make the decision with herself, and you say, this is a simple procedure, getting from the stress. Stress make all of this syndrome. If the stress going, this syndrome, this will go out and fade up. So reassure the patient that that simple procedure coming from stress. So the title of this page of this lecture was From Stress to Functional Syndrome. Okay? The second, aerobic exercise is must. After reassurance, the first line. The third, you are reorganize professional and the family life in the brain of the patient. Cognitive behavioral therapy. The last one, observation, fulfills these steps, giving anxiolytics and antidepressant to help the patient, not to treat, but to help the patient to fulfill these steps. What about the guideline management of fibromyalgia in European Journal of Pain 2010, American Association, European Association of Rheumatologists, and German Association of Rheumatologists? They conclude that one is aerobic exercise, cognitive behavior therapy, then amitriptyline and cyclobenzaprine and the multi-component therapy. So the first evidence is aerobic exercise, cognitive behavior therapy, then drug after these 2 steps. What about tramadol? Anyone who thinks that tramadol action only affects the patient, he does not understand either health care or patient in developing country behavior. It is a very serious treatment. If the patient began with drugs, it must start with aerobic exercise, cognitive behavior therapy. What about anticonvulsants? Anticonvulsant with this study, pregabalin improves the global impression for the patient of fibromyalgia with increasing dose from here to 450. So pregabalin is evidence to treatment. Trigger point injection, no evidence. No evidence for intervention in fibromyalgia. The last one is narcotic, strong narcotic. Opioid use was more commonly associated with lower education, unemployment, disability payment, current unstable psychiatric disorder, substance abuse, and suicide attempts. So don't use narcotic. So the prognosis is hopeless? False. Programming the patient. طوع مخ العيان. Not only make pain better. The target is not the pain. The whole person is the target. Get the whole person good. Not worse, but pain is better. I didn't treat the pain in this person. I treat the whole person. The hope. Early aggressive treatment can prevent physical deconditioning and loss of function. Programming the patient. In our clinic, in poor area in Egypt, which is Bab al-Shariya hospitals, we advise the patient first before giving any treatment, avoiding stimulus such as caffeine, spicy meal, and milk product later in the day. Establish routine for going to bed. This surrounding with dark, quiet, and cool bedroom, and wake up in regular manner with routine going to bed and routine wake up in the same time. Hot, as patient can tolerate shower for 15 minutes after wake up and at bedtime. This is in a poor. This is our strategy in a poor area, which cannot do anything other than I will see you the optimum treatment for fibromyalgia by exercise and behavioral therapy. Aerobic exercise on regular basis at home. مش في النادي، معهمش فلوس يروحوا النادي ولا الجيم، في البيت يعملوا aerobic exercise. ده البروجرام اللي لازم يمشوا عليه قبل ما اديهم علاج. Before any drug administration. Programming the patient again. Where should we set the bar? يعني صعب أوي. It's difficult to the patient to fulfill this criteria. This is baby looking for this. It is very difficult. I can't jump this bar. Okay? Set the bar at level that patient can pass. Okay? This is a very simple exercise at home. Very simple, modified by me from the net. Take a home message. كفايه كده ها؟ هنروح بقى. Patient must be ready to heal. Patient have to play role in order to get better. Patient must participate in lifestyle change. At least go bed and wake up and routine matter. Exercise at home or in home. Physiotherapy, hot shower, in home. Make sure the patient has begun to move in the right direction before providing drugs or intervention. If she is not ready to make this sacrifice, she will not get better. This is the ideal physiotherapy. We can do it with facilities. Now fibromyalgia. Good news, start but bad news. But now, good news by stress control with aerobic exercise. And this is the end of this lecture. Thank you very much.